Thanks for your patience, all of you. I will look into mental health strategic planning. And I have two take-home messages. One is to promote mental health and to prevent depression. I think that's the most important thing we could do now as a society. And what is mental health? There's a definition. Mental health is defined as a state of well-being in which every individual realizes his or her own potential, can cope with normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. And I think we all want to be helpful and we want to be part of a community. And it's more and more difficult for more and more people in the Western world. And actually, worldwide, depression is the leading cause of disability. And it starts from when you are 15 years old. So this is really serious. And in the study, Lisa talked about the Danish study with children. We look at children aged 12 years old, and they are doing fine, but they are not 3 years later. Then depression is the leading cause of disability. So it's really important that we take this seriously and we promote mental health and we prevent depression. And I don't know if you understand how huge this problem is, but in each year there's 800,000 people who die from suicide. Each year in Syria there are 100,000 people being killed. So 8 times as many people die from suicide. And a question to ask is, what is this kind of culture that we have created where many young people don't want to be part of? As a parent or as a citizen or as a person, then it's such a serious question to make a society where people want to be part of. And we can't understand that we are the most privileged people in the world, and then still it's a huge problem that many young people don't want to be part of the society. And then luckily, on a global scale, there is a vision that we can do this, that we can create a new world. And there's sustainability goals for 2030, and number 3 is to ensure healthy life and promote well-being for all at all ages. So this is a worldwide goal that I think we should work in collaboration with top universities and all over the world in order to make this world a better place. And number 3 is good health and well-being. And number 3.4 is to promote better mental health, promote mental health, and to prevent diseases like depression. And then number 17 goal is partnerships, that not one person can do this on their own, and not one country. We have to work in partnerships and not one discipline. And often when I go and talk to people about health promotion, then if I talk to psychologists, they say, more psychologists. If I talk to doctors, they said, more GPs. And if I talk to whatever profession, then they want to promote their own profession. And it's wonderful that each profession has some skills that can be used in this. But I think we really, really need to work together and to work on different perspectives. And so often we get into this competing mode where if the psychologists, they get the stress, then the doctors, they want the depression. Or if and then we don't collaborate. And then we are in this mode where we compare, and that's the mode that's, maybe it's the default mode that most of us are in when we are doing nothing. Then we are comparing, how am I to 10 years ago, or 5 minutes ago, or 10 years from here, or compared to my colleagues or to my other citizens. And the mindfulness training is to see that you are part of the world, to gain inner peace through mental training, where you recognize your own potential and recognize your own unique place in the world from which you can connect with other human beings, which are what makes us more happy, when we connect with other people. And when we are too occupied thinking about ourselves and how we are on a scale compared to other people, then we don't connect, then we're just self-absorbed and we are unhappy. And we are engaged in a partnership with Brown Mindfulness Center. And when I first came to the Center for Mindfulness, which was at that time placed at UMass Medical School, I felt at home and I felt safe in a circle among other fellow human beings. And I actually wasn't aware of how much I was suffering thinking about myself. And some of that burden left my shoulder, and I recognized other people. And I had a conversation with one of my supervisors, and I said, how I've been teaching mindfulness was all wrong, and I was so worried because I have been giving a lot of advice, which is not what you're supposed to do when you teach mindfulness, according to the real mindfulness training in mindfulness-based stress reduction. And then she just listened to me, and we had a conversation for 5 minutes, and I felt that she loved me. And then afterwards I was thinking, well, why was I feeling like this? And because of course she doesn't love me. But then now I have this kind of conversation with all kind of people that I don't know, that you can share some common humanity aspects of life with your fellow citizens, and you don't need to be your close friends, or you don't need to be in the same profession or the same social status, but you can just, if you let go of your own preoccupation with yourself, then you can actually meet other people, and it's nice. It feels good. And this is a center that's built on these core values of what brings us together as humans, and how can we create healthy groups where people feel that they belong. And I think that's the most important thing in health and in a society, that you feel that you belong. And in Oxford, they have dipped into depression, and mindfulness-based cognitive therapy is designed to prevent depression. And it's an evidence-based, cost-effective treatment for the prevention of depression. And since 2009, it's been recommended as highest priority for implementation for the National Institute of Health. And 10 years is a long time, and we have not started using this in Denmark as part of the national healthcare system. And with such a serious problem, I can't understand it. I think we should invest our money in this, and we should give this to all the young people and all people who are suffering from depression. And in the UK, they have made report called Mindful Nation UK, and it's the most ambitious plan for better mental health. And they are recommended that all people with depression, they should have mindfulness. All people with chronic disease, they should have mindfulness. All children, they need to practice. All adults need to practice. So everybody needs mindfulness. And that's because the research is encouraging. And for the last 4 years, I've been working for building a Mindful Nation DK. And to your top left, or the far left, it's the former Prime Minister. And I gave him my suggestion for better mental health in Denmark. And we had 5 suggestions. And now we are actually working on all 5 areas. And in the magazine, that's free for all of you, then you can see histories in all areas of people who are getting access to this. And these are some other politicians. And this is the new Prime Minister just here. And she wants to be a minister for children. And I really hope that I will have the chance to talk to her. And because that's the most precious thing, if you can change the direction that stress is going in children now. If you can reverse that, that would be a huge, that would have a huge impact for the whole country. So we're working, promote better mental health, prevent depression, and we're working with children and youth, with adults, clinical populations, with healthcare professionals, caregivers, and leaders. And we made 2 documentaries where you can see how children are working with this and how young people are working with this. And adults who are working with mindfulness-based stress reduction, we made a movie also, and we can see in if you go out in the workplace and you test what is the stress level, then in many places the stress level is 40%, and people are not aware of how stressed they are. And then you can reduce that to 12% with simple methods. And we need to use mindfulness-based stress reduction for chronic disorders. And in Eric's slides, maybe you remember that MBSR is much less expensive than CBT, and it's because it's in a group and people learn things that they can do by themselves. So when you deliver a group intervention, it's much more cost effective than individual therapy. Mindfulness-based cognitive therapy should be used for depression, and Amai is a PhD student, and it's a collaboration between Aarhus University and Oxford University. And it's not looking into whether this is working for depression or not, it's working into the mechanism. How is this MBCT working for depression? And we had 80 patients. They had 3 former depressions. They have medication, all the treatment that that there's access to. But you can see that before the intervention, the level of depression was that high, and after 12 months after, it was much lower. And depression is a disorder like fever. You can have fever for many kind of reasons, and then MBSR is able to reduce the fever. And maybe in 10 years we will understand that these different kind of depression with different kind of mechanism is better with mindfulness or better with CBT. But for now, if we give it to all, then we can lower the fever or lower the depression, and it's significant. It's highly significant. And there's 3 big reviews on depression with mindfulness, showing that it's working. And there's evidence with the cost-effective interventions. So in the beginning, I've thought when we had this wonderful research, and I talked to policymakers and health planners, that maybe it's because it's so expensive that it's not being implemented. But it's not, because it's actually more, it's less expensive. So the intervention can make people better, and it can save money. So it's like we need to think in another way, that this is also an evidence-based program, and it's something that should be implemented. And then there's been some hype around mindfulness, and then there's been an area where, mindfulness, we know, I have tried these CDs, it's not working, or that you can buy mindfulness everywhere, and mindfulness can be all these different kind of things, but there are these evidence programs that we should be using. Then for caregivers, Nanya is another PhD student who's doing a project on caregivers with a program called Compassion Cultivation Training. And it's so important that we take care of caregivers, because if they start to suffer from stress, anxiety, depression, then they can't take care of their loved ones. And they are doing a huge work, and it's important that we support that. And then it's important that we work with leaders and leadership training. And one of the principles in the sustainability goals is to leave no one behind. And nothing could be more important, because we are so lucky that we are in a safe place, but when people don't feel safe, then they can be a threat to the society. So yes, of course, we need to take care of each other. And I think the circle is a really beautiful symbol, and we have provided free mindfulness in Aarhus and Copenhagen once a week for 1 hour, and this is from the town hall in Aarhus, and we hope to do the same in the Copenhagen town hall. Now it's in Emdrup, 5 minutes by train from here, 10 minutes, but once a week. And I think there's something really beautiful with a lot of people sitting in a circle doing nothing, just breathing and being human together, become aware of that you're alive, which is the most important thing for all of us to recognize and to understand. And then I think you got my message, but if you didn't, there's a Danish translation that you have to promote mental health and prevent depression, or styrk mental sundhed og forebygge depression, because it's evidence-based, proven. Last time when I did this, when I taught at once a week drop-in mindfulness class, then a young person, he's 28 years old, he's a student, came and said, I read your book, and I started practice mindfulness, and now I went through a MBCT course, and now I'm out of medication and it's working, and I think this should be part of the national healthcare system. And he wanted to come, but this is the holiday month started today, and so many people are away, and many people, they said they would like to come, but he made a video where he's telling this. It's on our Facebook, and there's another video clip I can show with another person recommending this. Thank you. I went through over time, but we could maybe, if there's questions, we are happy to take questions. Thank you.